Meanwhile, the pandemic rages on. There have been nearly 9,000 confirmed COVID deaths and well over 700,000 confirmed cases. Thousands of Ohio frontline healthcare workers, first responders, and nursing home staff and residents have gotten at least one dose of the COVID vaccine. And a new group will be eligible in a few days. But there are some questions about how those who are first in line are getting to be there. Statehouse correspondent Jo Ingles reports.
About 2.2 million Ohioans will be in the 1B group, the next to get the vaccine. The CDC says anyone over 65 should be able to get the vaccine, but there's limited supply, and Ohio has a goal of getting kids in school. So starting Tuesday, Ohioans 80 years old and older can get it. On the 25th, people over 75 and those with certain congenital, developmental, or early onset medical disorders can get it. On February 1st, the cutoff age goes down to 70, and K through 12 school employees are included, provided the school is or will do in-person or hybrid learning by March 1st. Then on February 8th, anyone 65 or older can get it. The state's first priority had been with healthcare workers and first responders, but police were not included with EMTs and firefighters in that first group, and they haven't been included in the second group with school employees either. That means a community resource officer who works in a school could get the vaccine before counterparts who work on the streets.
Why is it so important that the teachers jumped ahead of law enforcement? And law enforcement and EMS folks are really, the most largest group of folks that are contacting people every day. I mean, EMS guys go on a lot of calls. Typically, cops are on the same calls the EMS guys are on.
In addition to teachers, the 1B group also allows Ohioans with some developmental disorders or some physical illnesses to get the vaccine. But some illnesses are not included, such as cancer.
It's clear that cancer patients do have an increased risk of severe illness linked with COVID-19. And so the American Cancer Society and the American Cancer Society Cancer Action Network certainly believe that cancer patients should be among the groups that are prioritized for vaccination.
There's also some vaccine reluctance. At one point, only 40% of workers in long-term care facilities were opting for the shot, many rejecting it based on misinformation or disinformation.
They see on social media that, the government's putting microchips in you, or the government's putting a vaccine out there that hasn't been properly studied, and they rushed it to market.
Of course, those claims are false. Pete Van Runkel says most nursing homes won't require vaccines because they're already short-staffed. He expects many workers who declined the vaccine at first will get it the second time around, after seeing others who received it are faring well. And in at least one Ohio facility, the vaccine rate is 100% for residents and staff.
This was the mentality. This is what we're doing. This is what I expect. And sure, I will educate. I will ask questions. I will bring in the medical director. I will, all that kind of stuff. But at the end of the day, this is what we're doing. and it worked.
The distribution of the vaccine to the general population is falling on local communities. They determine how to sign up, participate, and where to receive the shots. Marion County, like many bigger counties such as Cuyahoga and Franklin, is opting for a massive drive-through shot clinic.
There's still a risk of transmission of disease even now. We want to minimize that. It also allows the most efficiency. We can do a very high volume of throughput in a very short period of time with a drive-through mechanism. So ours is at our county fairground. We will be directing seniors to register at an online link.
Ohio State's Wexner Medical Center plans a shot clinic at the Schottenstein Center. The state says around 800 health departments, pharmacies, and other providers will be vaccinating the 420,000 Ohioans over 80 this coming week. And Ohioans can find those locations by zip code through a link on the state's coronavirus website. Jo Ingles, Statehouse News Bureau.